Screening right now for multiple myeloma is pretty much non-existent. What we would like to do is to have that become a normal thing for people who are over the ages of 40. With other types of cancers, like colon cancer, you get a colonoscopy when you become of a certain age. With breast cancer, you get a mammogram. What we want to do with these results is to really make it clear that individuals who are at a high risk should be screened as soon as they become of an age where it is necessary to screen them. And what we're seeing so far is that the results really show that this is important for people and that people want to know. So not only is it important medically for us to be able to take this information back into the medical community and share it with physicians and doctors and let them know, like a primary care doctor, that you should be telling your African American patients and your patients who have first degree family members with the disease that they should be screened, but also that patients themselves are coming to us and saying, this is really important to me and I want to be a part of this project because I saw a family member go through it, or I know I'm at a higher risk for it, and because of that I want to be screened. And so it's really kind of a two combined effort, because we have physicians working on one side and we have patients working on the other. And I think at the end of the day, medicine runs and works a lot better if we have both of those communities joined. Our website is www.promisestudy.org, and we are very happy to have physicians reach out to us if they want brochures or any type of material in their clinic and more information to share with their patients.